In this video assessment, we are going to be doing a head-to-toe assessment. Can I come in?
Yeah.
Okay. I'm going to go ahead and wash my hands and introduce myself.
Okay.
Hi, my name is Alpha. I'm going to be doing a head-to-toe assessment on you. Is that okay?
That's fine.
Perfect. Can I see your wristband? Can you give me your full name?
Annabella Fernandez.
Date of birth?
October 27, 1998.
Perfect. So it matches. So we're starting off at the head. We want to verbalize two facial symmetrical landmarks, the palpebral fissures and nasolabial folds. We want to next, with gloves, palpate the head and scalp, palpate the temporal arteries, the temporomandibular joint. So in this case, we're asking the patient to open and close mouth while we palpate. We want to ask them to clench their teeth, which will test the cranial nerve 5. We want them to smile, puff cheeks, squeeze eyes tightly, and wrinkle the forehead. That will be testing their cranial nerve number 7. Next, we move on to the eyes, where we test the extraocular eye movement, which will be testing the cranial nerve 3, 4, and 6. So the patient will be following the movement of her fingers and shouldn't be moving the head. Next, we're looking at their visual field by confrontation. So the patient will cover one eye and then should be able to tell us when they see our finger. And they're going to do that with the other eye. So cover the left eye and tell us whenever they see our finger. Next, we're going to look at their pupillary response. Tell the patient that we're dimming the light and what to expect. Next, we're looking at the ear. We want to perform an external ear inspection, looking at it, making sure they don't have any lesions or any abnormalities, and we're going to palpate the ears. Next, let's move on to the nose. So we're going to perform an external nose inspection and palpation. Next, we're going to check for patency. So we'll ask them to close one nose hole and breathe in, breathe out, and we try it with the next one. Next, we're looking at the mouth. We want to inspect the lips, the hums, the tongue. We want to look at the base and the floor of the tongue, and we also want to look at the teeth and the oral mucosa. For this patient, everything looks fine. The oral mucosa looks moist and pink. We're using a tongue depressor or a gloved hand to do this inspection. We also want to inspect the posterior pharynx and inspect and examine the elevation of the palate and the uvula, which is the cranial nerve X. By that, the patient saying ah. We want to inspect the tongue movement by asking patient to stick tongue out, push each cheek, and we want to push each cheek with tongue bilaterally. Next, let's move on to the neck. We're identifying the landmarks for the thyroid palpation. We want to palpate the thyroid gland posteriorly and anteriorly. So we're doing the posterior palpation of the lobe with and without swallowing. And then we are doing the anterior with and without swallowing. Next, we want to palpate the neck nodules, so the occipital, the preauricular, post-auricular, the tonsillar, the submandibular, the submental, anterior cervical, posterior cervical, and supraclavicular. Whenever we palpate the nodules, it's supposed to be soft, there's no pain, or it doesn't feel swollen. Also, we want to next palpate the carotid artery one at a time, and then auscultate the carotid artery with the bill of the stethoscope. So for this one, we want the patient to be breathing hold their breath, while we're listening, and then breathe again whenever we're finished. So when we're auscultating the carotid artery, we aren't supposed to hear any bruits or any swishing sound. Next, we move on to the heart. Go ahead and palpate the bilateral radial artery, dorsalis pedis, and posterior tibial. We also want to go ahead and auscultate the 5 areas of the heart, which would be the aortic, the pulmonic, Erb's point, tricuspid, and the mitral. We're doing all of this with the bell. So whenever we listen to the apex, the S1 would be greater than the S2. And when we listen with the bell, the S2 would be greater than the 1. For the S3 and S4, we shouldn't be hearing any S3 or S4. That would be any murmurs. Next, we're moving on to the chest and the lungs. So we want to percuss posterior lung fields. We also want to verbalize other areas of the chest that would be percussed. We're going to percuss the CVA, costal vertebral angle, and if it's normal, the patient would not verbalize any pain. Next, we want to perform tests for tactile firmitis. So we're starting off at the top, and we're asking the patient to say 99 as we go along. We want to go ahead and auscultate the posterior lung fields, and we want to listen to the inspiration and expiration of the patient at each position. So we're following a Z pattern. We next want to auscultate the anterior lung field and the lateral lung fields. Next, we move on to the abdomen. So we're placing the patient in the proper position, and we want to expose the area that will be examined. So for privacy purpose, this patient in my video is wearing their shirt. So we're gonna inspect the abdomen. We want to make sure that we see that it's normal, that there's no abnormalities, no pulsation. Next, we auscultate all 4 quadrants for the bowel sounds. We're using the diaphragm of the stethoscope, and we're starting from the right lower quadrant. We're going to the right upper quadrant, then the left upper quadrant, and the left lower quadrant. We're trying to auscultate for any vascular sounds, any in the aortic, in the renal, in the iliac, and the femoral. Again, we're using the bell of the stethoscope, and then we're percussing all the areas. Next, we're going to go ahead and palpate all areas lightly, making sure that we do it systematically and we don't miss a spot. So again, right lower quadrant, right upper quadrant, we're doing the left upper quadrant and then the left lower. Then we perform deep palpation, where we use 2 hands and we try to depress the abdomen deeply as compared to a light palpation. Next, we want to palpate the liver, the spleen, the right and the left kidney, and the aorta. Lastly, we're going to do the neuro assessment. So we'll ask the patient to sit up. We're going to next ask them to rotate their head against the resistance. This is going to test our cranial nerve number 11. So we're doing it on the right and the left. Next, we're going to ask them to shrug their shoulder against resistance. That's, again, testing cranial nerve number 11. To test our patient's upper extremity fine motors, we ask the patient to hold their palm out and touch their thighs, and then rotate the hand and touch their thighs. So we want them alternating that as fast as they can. Next, we're doing the finger to thumb test. And again, we're asking them to do that as quick as possible. And then we're trying with the other hand, the thumb to each finger as quick as possible. Next, we're going to test the finger to finger with the eyes open, both sides. And then we're going to go ahead and look at the fine motor coordination in the lower extremities. So it would be an ankle to shin. And they're going to be moving it from the knee to the bottom of the legs. Next, we're going to go ahead and test our patient's reflex. We don't have a reflex hammer in this video, but we're just showing exactly where it would be, and patient would react to these tests. We're testing for the patellar reflex with our reflex hammer, the Achilles reflex with the reflex hammer, and then we want to assess for their positional sense of their great toe. So if they feel whenever we touch the great toe, and then whenever they feel the vibration from our tuning fork, which again we don't have but we're simulating, touching the toe, and then they would express that they feel the touch. Next, we're going to ask our patient to stand up, and we're going to test for rompers. So the patient is going to walk a straight line, 1 foot in front of the other, and we're going to be looking at their gait. So for this patient, their gait is properly fine. So we're asking the patient to walk back with the heel to toe, and that would conclude our assessment. We want to go ahead and wash our hands and complete our documentation.